We're joined now by Dr. Ashish Jha. He's Dean of Brown University School of Public Health. Good morning to you, Dr. Jha. Always good to see you.
Good morning, Gayle. Thanks for having me back.
I always wait for you to say that. I know it cracks me up, too. Let's go back to David's piece about that booster shot. How important is a booster shot, and when do you think it'll be available?
Yeah, so first of all, I don't know if we need it. I'm just really not sure, Gayle, because the current vaccines really do look like they're working pretty well. So I suspect that
they say
we may not need it at all.
because of the variant, though. But what they're saying we need it because of the variant. You're saying maybe not?
Maybe not. Maybe not. I mean, even the current vaccines seem to work pretty well against the variant. You know, the J&J vaccine was tested against that variant, worked pretty well. Nobody got hospitalized or died. So, first of all, I don't know if we need it. If we need it, it'll probably be sometime in the fall, I suspect, at which point we should have enough for people to get it. So we'll have to see. But I remain pretty optimistic that we may get away without needing it at all.
We have another weapon, as you know, coming out in this war that we call COVID, the J&J vaccine, Johnson & Johnson. And already people are saying, only one dose? I don't know if that's good. Or what happened to having 2 doses? So could you sort it out? Already people are asking a lot of questions about which vaccine is the best, Pfizer, Moderna, J&J, 1 dose versus 2. What do you say about that?
Yeah, what I say to folks is, first of all 3 vaccines are superb, and let me tell you why. Look, at the end of the day, what do we care about? What we care about is making sure people don't get sick, they don't get hospitalized, and of course, most importantly, that they don't die. All 3 of these vaccines are superb at preventing severe illness. And there are minor differences otherwise. Obviously, J&J has the upside of 1 shot only. And what I'm saying to my family is, when it's your turn, get any of the 3 vaccines, and don't worry about which one.
Get whatever is available. I got a call yesterday from friends who are grandparents who have both gotten their vaccines. They're ready to go. Can grandparents who have been vaccinated, can they see their grandchildren? And why do we still have to wear masks after we get the vaccines? So do the grandparents question first. A lot of people are wondering about this.
It's a really good question. And look, obviously grandkids, others are not vaccinated yet. I think the way I look at this is with the vaccinations, grandparents are now much safer. And so I think it is much easier. What I would ideally like is for, if the outbreaks are still very large in the community, for the infection numbers to come down a bit more. But this is the conversation I'm having with my parents. They want to see my kids. I'm not sure they want to see me, but they definitely want to see my kids. And they, and we're trying to figure out when the right time is. And I think sooner rather than later that will become safer, especially as infection numbers continue to come down.
And it's important even after you get the vaccine, Dr. Jha, as you know, to wear a mask, maybe even 2. I even started wearing 2 now because of you. You still got to wear the mask even after you get the vaccine.
At least for a little while, and the reason is because there are a lot of people around who are not vaccinated. So I've gotten a vaccine, but my wife hasn't. And I want to make sure that if I'm out and about and if I get infected, that I don't spread it to her. So that's why I wear a mask in public, to make sure that I can keep other people who are not vaccinated safe. At some point when everybody's vaccinated, the masks can come off in most instances. Only in rare instances, I think, will we need to continue to wear a mask.
All right, Dr. Jha, we thank you. And something tells me your parents want to see you. The numbers at Brown University of COVID are way down compared to what's happening in the state of Rhode Island. So kudos to you. Thank you very much for joining us this morning.